All right, so I'm going to go over some of the tools you may see in our office. Some we use for diagnosis, some we use for treatment, but mostly with chiropractic you think we use our hands, but every once in a while we do need some tools to help us out. One thing we can use with diagnosis is a sphygmomanometer. You've never heard that term, but it's a blood pressure cuff. So we use this with a stethoscope to take blood pressure, make sure that your blood pressure has safe levels for us to adjust. If we're worried about really high blood pressure, that's when we'll bust this out. Some other tools we may use for diagnosis are these three things. These two are called pinwheels, and we will rub these across the skin very lightly to make sure you can feel them equally sized, so that way we can tell if there's any nerve deficits or any entrapment of the nerve. This is a reflex hammer. I'm sure you've seen this in the movies and you've done this as kids. This also helps with diagnosis of any kind of change in nerve reaction. We either see too much reaction or not enough reaction. So this tool is a nice little trick of the trade. I call it the poor man's x-ray. What we do is we get a good vibration going on the tuning fork, and then we'll place this on the part of the body where we may suspect a fracture. If it causes a lot of pain, we suspect there's a fracture there. And that's because the vibration rubs the two pieces of bone together, causing pain. Then we will go ahead and confirm with an x-ray. So some treatment tools we use. We will use this called a gua sha, and we can rub this across any tight muscles, any trigger points, trying to break them up. It's a very good fascia or muscle work. We also like to use this. I'm sure you've seen this or have heard this. It sounds like a little stapler. But what it does is it gives a quick impulse, allowing us to adjust the joint very quickly without a lot of force. It's called an activator.